Hello and welcome to a webinar. This is Dr. John Sherman from the Tahoma Clinic, and this is a recording of a previous Tuesday talk that I presented on inflammation and aging. Recently, over the last few years, the combination of the two topics has become something called Inflammaging, and that's what we're going to be talking about today. It's a fascinating subject. Inflammation is often the cause of many aging disorders and a cause of many diseases. So what is inflammation? Of course, everyone knows the classic signs of acute inflammation, including redness. There's heat given off from the inflammatory site. Typically there's swelling and pain. The pain is actually protective, so don't re-injure it. And typically there's loss of function, so we try to protect that. With acute inflammation, of course, it can be bacterial or viral, a serious injury which creates a lot of swelling and heat. Sometimes the infection will wall off and form an abscess. And eventually the inflammatory changes that occur, the abscess is either reabsorbed or resolved by gradual breakdown. Chronic inflammation is a different process, and like so many other pathological progressions in the body, whenever you have acute inflammation that happens over and over and over again, the body responds in a chronic inflammatory process. So chronic inflammation, of course, can occur over many months or even years. This can obviously create problems with tissue destruction, fibrotic buildup, and adhesions and scar tissue. Everyone has heard of people that have had a splinter or maybe even a bullet in their body, lodged in their body, and the body just adapts to it. It doesn't necessarily keep creating inflammation. It tends to wall it off and protect the rest of the body from that invader. Sometimes these chronic inflammatory reactions can be caused from many different exogenous sources, including heavy metals, acute infections, foreign bodies, and even autoimmune reactions. So what are common inflammaging diseases? Probably the most common are systemic inflammatory processes. So these would include arthritis, asthma, allergies, and of course heart disease. And over the last decade, heart disease has gotten a lot of research funding, studying this whole process of inflammation and what is going on with inflammation as far as heart disease goes, and especially within the arterial circulation. And of course, when this happens in the brain, there can be dementia, including Alzheimer's disease. And over decades and years, even cancer develops, mainly as a result of a chronic inflammatory process. The more overweight we are, or the more weight we carry, it's more likely to produce inflammatory cytokines within the body. And of course, diabetes can also result in autoimmune problems. There are benefits, of course, to an acute inflammatory reaction, but our bodies, when we talk about our diet, there are certain prostaglandins that are produced that are pro-inflammatory. So these are the things that actually protect us. For example, if we twist an ankle or we get a bee sting that gets infected, our body responds appropriately by providing fluid to clear the area and dilute the poison. And these omega-6 prostaglandins also help to stimulate the acute response. Once that has been taken care of, then the anti-inflammatory prostaglandins take over, and they help to resolve the acute aspects of the inflammatory process. So part of the problem that's happened in our Western culture is that our diet has changed dramatically to, in caveman days, it was fairly equal as far as omega-6s and omega-3s. But the more processing, the more carbohydrates in our diet, and abnormal alien fats, I'll call them. Our modern diet is now much more pro-inflammatory as far as omega-6 levels compared to omega-3s. Recent estimates show the ratio is approximately 20-1. And what are lifestyle things that actually promote inflammation in the body? You know, obviously smoking is very, very irritating to the body. We talked about being obese and carrying excess weight. We're going to be talking a lot in a few minutes about inflammatory foods that actually contribute to the inflammation in the body. And of course, the whole digestive tract is a major source of inflammation within the body. The more efficient we can maintain our digestive tract, including HCl production, enzyme production, probiotics in the colon, these all help to reduce inflammation, acute inflammation, and reduce allergic reactions, arthritic symptoms, all down the list. So digestive tract is one of the main ways of lowering the inflammatory load in the body. And of course, the more sedentary a person is, the poorer circulation tends to be in general. So without exercise, you tend to not dilate the smaller capillaries throughout the body that go through the various organs and finer muscles. Stress is another pro-inflammatory, which over time actually reduces the DHEA levels, and it's also been shown that a lack of various hormones, including testosterone, DHEA, cortisol, these can eventually create more and more inflammatory imbalance. And obviously, we're all exposed to various chemicals, heavy metals, drugs, the overuse of drugs. These are quite an inflammatory burden on the rest of our bodies. So by helping our bodies take care of this in an appropriate way, we can discharge these toxins in an efficient way on a daily basis. So what is aging? There's various ways we can measure aging. We can measure in years alive on the planet. We can also measure how much wear and tear has actually occurred within the body, something called biological age. This is a much more appropriate way of really monitoring your age versus just number of years. And of course, the more wear and tear you put on your body, whether it's working at a difficult job or being exposed to toxins, this is going to create DNA damage and also cellular aging. One of the recent ways that research is showing how we age is by telomere shortening. These telomeres occur, of course, on the DNA and chromosomes within our bodies. So by actually measuring these telomeres, we can determine how long the expected age is for that particular cell. Another measure of aging, of course, is cell membrane damage. And many various toxins are accumulating within the cell membrane, which cause oxidation and damage to the cell membrane itself. So the more anti-inflammatory products we can introduce, the more antioxidants, we maintain that cell membrane protection to help prevent cellular death. The more waste we accumulate, whatever the toxic material is, that can influence our DNA as it progresses and multiplies on and on. If there's an error in the production of the DNA, that's going to be maintained for the lifespan of various chromosomes. So what we try to do is prevent that free radical change and the oxidative stress load on the body as a whole, and the body has a much easier time of handling these waste materials. So what are the most pro-inflammatory things that we're exposed to. This is a very, very efficient list at creating a lot of chronic inflammation. So drugs in general have multiple side effects. They're hard to break down for the liver and the kidney and chelate out of the body. So no matter what we're consuming, whether it's a drug or an apple or a carrot, your body's going to try and break that down, metabolize it, utilize it, and then get rid of the waste. Some things are much easier than others. And of course, toxic metals, we're all exposed to toxins and chemicals. These alien molecules can create various problems. Anywhere from allergies to cancer can be caused from these things. Allergens are an obvious pro-inflammatory process. Some people lose their sensitivities to various foods or airborne allergens once their immune system, once their circulation and their inflammatory load goes down. They no longer react to these sensitivities. Of course, air pollution, the more we are exposed to that, it puts more and more inflammatory load on the body. Something I call toxic water, for example, tap water. A lot of people drink right out of the tap, which contains a lot of different chemicals and everything from hormones to old drugs and fluoride, and not something one would normally utilize efficiently to help cleanse the system. Tobacco is something everyone knows is a toxin, the way they make cigarettes these days. And of course, abnormal gut flora. The gut flora is almost an organ in itself, and it can be a very anti-inflammatory organ. Once those probiotic material and organisms take over as an efficient unit, they can provide a lot of immune protection and anti-inflammatory properties. One of the things I like to measure in my patients is how much tissue acidity they carry, and this is an overall reflection of how much inflammation they're carrying. So I will often measure saliva and urine to see on an average how much acidity they're carrying and how much they're discharging. Overeating in general can create more inflammatory reactions. Constipation can also be a problem. The more we retain old material that we've consumed, it can ferment and create a lot of toxic material that gets reabsorbed back into the bloodstream, causing arthritis and all kinds of inflammatory changes. Overprocessed foods, very hard to metabolize. Stress in general raises catabolic hormones, which create more inflammatory changes. And as we said before, the less exercise, the less circulatory movement that we create, the more likely these inflammatory products are going to deposit somewhere. And here's some interesting tidbits. There are various animals on the planet that are being studied to see why they live such a long time. For example, turtles. Some are living over 250 years, and they've, of course, lived on the planet for many millions of years. Some of their organs have been shown to just not break down over time compared to human organs. And interestingly, the liver, lungs, and kidneys of some of these turtles have been found to be indistinguishable between teenage turtles and 100-year-old turtles. This is a really good sign of longevity, because if we can keep our liver and lung and kidney in good shape, obviously we're going to live a long time, because these are major organs of elimination that need to be detoxified. Researchers are studying the genes of these turtles to see if we can glean any information that might benefit the human species. There's also a rodent that lives 28 years, which is lengthy, called the naked mole rat. It's interesting, they have a very, very slow metabolism. They can reduce their metabolic rate up to 25% whenever they want to. Their blood has a very strong affinity for oxygen, so it does actually maintain their circulation more efficiently. They have no measurable amount of histamine, so they don't have common allergic reactions that humans do. This is fascinating. They also have a gene that protects against cellular overcrowding. This is a fascinating research that, of course, could provide incredible promise down the road for prevention of cancer. And I just wanted to mention one jellyfish has been found to be considered biologically immortal, and it's quite a statement. This particular turtle, the Teratopsis nutricula, reverts to a sexually immature stage after reproducing. So it seems to just keep dying and creating another fish. So when we look at the overall population of the planet, we find that many European countries have a high percentage of people living over 65. The U.S. is only 12.8%, but compared to Monaco, which is 22%, quite a big difference. Some other interesting studies. A 2007 study, they found in Italian 100-year-old people, these folks had high circulating levels of vitamin A and vitamin E. So that could provide a clue as to nutrients that might help prevent aging. And in Denmark, the Danes were found to have high red blood cell levels of glutathione and superoxide dismutase activity. As far as the record goes, the longest living person lived 122 years and 164 days. A French woman by the name of Jeanne Calment, and she was born in 1875. And as far as the official record, she is the oldest person to have ever lived. Interestingly, she took up fencing when she was 85. She's still riding a bicycle at age 100. And that's a good promotion for staying active and exercising. I thought it was fascinating that she smoked from age 21 up to age 117, but only smoked 2 cigarettes per day. So everything in moderation. She also attributed her longevity to consuming lots of olive oil, even applying it to her skin daily. And of course, that would be a lot of omega-3 oils. She would drink some port wine daily and also ate a lot of chocolate. So how do we slow this gradual aging process that is caused by inflammation? Probably one of the most important ways is maintaining an acid-alkaline balance within the body. Our bodies are always trying to maintain a 7.4 level of pH in the bloodstream. It's the underlying tissues that really suffer, because as we try to maintain that narrow margin of pH within the bloodstream, there's a lot of give and take going on behind the scenes in the tissues. So it's important to provide an alkaline reserve for your system. Otherwise, you can lose bone. There's very good research showing the direct correlation between acidity in the body and loss of bone in general, related to osteoporosis and osteopenia. Other key ways, obviously, to maintain good cellular membranes and avoiding using up your cells, basically. Providing the right minerals and nutrients that help maintain this cellular integrity. And of course, maintaining circulation. It's such a key. Any kind of movement, exercise, every time we're able to maintain circulation through whatever organ we're treating, oftentimes it can repair itself if given the chance. One of the things I look at with my patients is making sure all their drainage routes are open, and by drainage I mean organs of elimination, including kidney, liver, colon, lungs, skin, other things that have been shown to help slow the inflammatory process, of course, is hormonal balance. And also just plain old rest and stress reduction, having fun once in a while. And as we spoke about before, digestive inflammation can be a major source of inflammatory load. And all of these things that are listed here can be monitored through your naturopath, through the clinic. We tend to focus on these particular issues at the Tahoma clinic here. And pH testing in the stomach is by far one of the most utilized analyses that we do for people to determine how well they're digesting. If the hydrochloric acid isn't there, then you're going to have a harder time absorbing the right amino acids and B12 and various other nutrients, including the minerals. Oftentimes we'll do what's called a micro-digestive panel to see if your body is struggling with certain foods, say fats are harder to digest than carbohydrates or protein. A low gamma globulin level on a serum test can often mean there is digestive inflammation within the body. Because B12 and folate can be very difficult to absorb, we look at that to see how much inflammation is in the body to determine how easily things are getting absorbed. The more food sensitivities, the more leaky gut issues are going on, it's much more likely to be caused from digestive inflammation. There's also a urine test that I often use called urinary indican, which is actually a toxin that gets produced from this fermentation process that occurs in the colon. So these toxins get reabsorbed into the bloodstream, wreak havoc throughout the body, sometimes cause migraines, arthritis, asthma, all kinds of high acid problems. Other ways I measure the amount of tissue inflammation. C-reactive protein is a very simple test. I use the highly sensitive C-reactive protein, and I try to keep that under 1.0. I also look at fibrinogen, homocysteine, the sedimentation rate, and a little more costly, but we can also measure interleukin levels, which are inflammatory cytokines, and also TNF-alpha, which has been linked to cancer risk. And these are ideal levels of CRP according to gender. And obviously, the less there is, the more likely you're not going to be suffering from a lot of these inflammatory changes. So what are the most common inflammatory factors that occur in the foods we're exposed to? Probably the who's who list here would include saturated fats. These are fats that stay solid at room temperature. So deep fried foods, trans fats, artificial foods like margarine, Crisco, these create more inflammation within the body, and this has been measured. It's not a bias against these foods. It's just been measured that these create more inflammation. And really wonderful foods, whether it's organic or not, meat, dairy, and eggs are high in arachidonic acid. So these require a little more breakdown, a little more digestive capabilities. So we again want to make sure that these foods are well metabolized before they build up in the system and create extra inflammatory load. The glycemic index is another means of measuring inflammation. And we can determine from that how much carbonic acid gets produced, and sugar is one of maybe at the top of the list as far as producing inflammation within the body. And of course, a lot of foods just don't have many antioxidants contained in them. So the foods that are organic tend to have more selenium, more zinc, more vitamin C, A, those sorts of things. The foods that are more protective are the monosaturated oils. These are liquid at room temperature. And of course, these include olive oil, avocado, sesame oil. These have a high EPA-DHA ratio, or content, and these are strong anti-inflammatory fatty acids. They're very high, of course, in seafood. Other antioxidants, vitamin C, E, beta-carotene, all help neutralize free radicals that are just naturally produced within the body. B vitamins, of course, are correlated to reducing homocysteine. Mineral antioxidants, selenium and zinc, are incredibly important. One study found selenium prevents 50% of cancers. Just at a minimal dose, 200 micrograms per day, the amount that occurs in 6 Brazil nuts, could cut your risk of cancer by 50%. And there's also phytochemicals that are anti-inflammatory that occur in foods like curry, turmeric, ginger, garlic, onion. Pineapple has bromelain as an enzyme, and also in chili peppers. And I'm quickly going to run through various foods that are some of the best and some of the worst as far as inflammatory load. Obviously, these can be fantastic foods once in a while, but if you already have signs of inflammation, if you're dealing with an autoimmune problem or have arthritis, asthma, signs of inflammation, you want to stick to the best foods possible at reducing your inflammation. I'd like to refer you to a book called The Inflammation-Free Diet Plan. I like this book because it gives you scales as far as what foods are most beneficial and what aren't. Here's a list of more vegetables. Interestingly, deep-fried French fries are probably one of the most inflammatory vegetable, if you can call it a vegetable. White potatoes, of course, have a high glycemic index, as does corn. Dairy products tend to have a high inflammatory load. The more you can culture the dairy product, the less inflammation it carries. And of course, fish have a lot of EPA, DHA levels, and you just want to be careful of mercury levels. Salmon is probably one of the best fish as far as reducing inflammation. Make sure it's wild salmon rather than farm salmon, which tends to have very little of the EPA, DHA. Other lists here, poultry is the darker meats tend to be more inflammatory, which carry more purines within them. And here is a list of various oils and fats. You can see, even though some of them are monosaturated, they may contain various fatty acids that are pro-inflammatory. So my top list here for things that help reduce the inflammatory load in the body and actually prevent inflammatory buildup, I would say fish oil, 2 to 3 grams a day is very safe and very easy to take, along with a fish meal several times a week. Once you get beyond 3, 4, 5 grams a day, then it can affect your clotting ability somewhat, but definitely see your doctor about that. Other spices that I like to use, turmeric is a very powerful anti-inflammatory, and I also use ginger and cayenne. The benefit of cayenne is that it can dilate the vessels, depending on where you're trying to achieve the dilation, but it's a very good circulatory stimulant. Oftentimes I'll also use nettles, ginkgo, or boswellia as anti-inflammatories. And there's a myriad of enzymes that can also be used, including bromelain from pineapple, papain from papaya, and tart cherry is a very powerful anti-arthritic. Hormones, vitamin D, melatonin, DHEA can also be quite powerful in reducing inflammatory load. And of course, antioxidants, CoQ10, resveratrol, glutathione, and quercetin can reduce histamine levels within the body. And of course, inflammaging is also linked to our immune systems. So we want to make sure that by reducing the inflammatory load on the body, we often prevent a lot of the diseases of aging, including Alzheimer's and dementia. So this is very important. Cardiovascular risk, similar. Quite a bit of research in the last decade linking CRP and homocysteine levels to the risk of heart disease. And the ability to reduce these are mainly through diet and nutrient levels. So as long as we can keep these levels, and they're the same list as we went through before, these things are very powerful at reducing the amount of inflammation in the body. Notice some of these nutrients are very powerful at dilating vessels again. So things like arginine, glutathione, vitamin E, they really promote circulatory health. Depression has also been linked to inflammation within the body. There is a correlation between major depressive disorders and the ratio of dietary omega-6 to 3 levels. And this is a really interesting study that was correlating C-reactive protein to the risk of death. And it's one of the best tests to really look at your overall risk of longevity. I would add looking at your waist-hip circumference, body mass index, triglyceride levels will also give you an idea of whether your body is getting too many carbohydrates or your glycemic load may be too high, let's say. Low HDL could indicate that you need more exercise. And of course, genetics is always a factor, but I would say it's a very minor factor. And we're much more likely to create inflammation from environmental exposure, whether it's the food that we eat or the toxins we're exposed to as far as creating chronic inflammation. So inflammation has even been linked with creating a lower IQ, premature death, higher risk of a deadly heart attack people don't survive from, obviously. So keeping the balance between these omega-6s and omega-3s can really keep you current as far as preventing inflammatory burden. Also, laughter helps reduce inflammation. Vitamin C, again, antioxidants. They also link the correlation between CRP and the risk of joint replacement. So a direct link there to arthritis. And poor sleep habits have also been shown to increase inflammation. Could be related to growth hormone levels or even melatonin. Inflammation, of course, can create bone loss because our body uses calcium pulled out of the bone to help neutralize the acidity within the tissues in the blood. We've talked about being overweight and the risk of heart disease and inflammation. Yoga has been shown to drastically relax people, put them in more of a parasympathetic state, which helps with inflammatory changes. And of course, Alzheimer's and dementias have been linked to inflammation. More and more research is being done to monitor the risk of cancer by, again, looking at CRP and homocysteine and fibrinogen, all inflammatory risk factors.